Well, I know that it's late and American Idol is on tonight, but I was invited to make a few remarks, and that's a dangerous offer to make to a lawyer, but I'm going to take the opportunity to do so. This is truly an honor for me to receive this award from Crisis and Counseling, because Crisis and Counseling is an agency that I respect for its diligence, for its competence, and for its compassion. Just 4 things I'd like to briefly discuss. Number 1, the importance of crisis and counseling to the success of our defendants and participants in the co-occurring disorders court cannot be overstated. Before each graduation, and we had a graduation in March, I review the files of each of the graduates in order to prepare my remarks. And those files can be big because some of the participants have been with us sometimes for years. And reviewing my notes, each graduation reflects that when I speak to the participants each Monday in court, they very often mention the people they're working with at Crisis and Counseling, how much they appreciate the services that they get, and how grateful they are. The people I specifically mentioned this year at graduation included Joan Murphy, David Lawrence, Julie Hopkins, Russ Kimball, and Bob Kingman. And there have been others in past graduations, and hopefully there will be more in future graduations. I know I asked Peter Wall to make sure that the people at Crisis and Counseling knew how appreciative the court and our participants are, but I just wanted to make sure that everybody knows that. We couldn't do what we do without Crisis and Counseling. The second thing is community involvement. I think increasingly that one of the most important byproducts of our court is promoting understanding in the community about substance abuse and mental health problems. When people don't understand something, they often will be afraid or sometimes angry or both. And a little communication and education goes a long way toward acceptance and even compassion. Everybody involved in this court, from defense lawyers to prosecutors to law enforcement to jail personnel, learn that people who face these difficulties simply are people who need help. And if they receive the help they need, in many instances, they will succeed. Number 3, the past and future of the co-occurring disorders court. To date, we've had 73 individuals participate in the court. Nearly half of the caseload are women, most of childbearing age, and we had 3 new babies this year from members of the court, and men averaging in their early 30s. Nearly all require that we help them with housing because they're homeless, as well as assistance in getting financial entitlements and insurance. Of the 30 current clients, 27 receive main care. All have been referred to and participate in a variety of substance abuse and treatment services, mostly at Crisis and Counseling, including IOP, DSAT, Seeking Safety, DBT, medication counseling, couples counseling, and interventions for criminal thinking. Each client has been charged with one or more serious offense and will face years of incarceration at the Department of Corrections if they fail. All of our participants have been diagnosed with moderate to severe substance abuse and mental illness, including severe and persistent mental illness. 61% of our clients have identified prescription drugs, most commonly narcotics, as their primary drug of choice or the abuse of one of these drugs at some point in their lives. Of the total CODC client population abusing prescription drugs, nearly all have been diagnosed as dependent or addicted to these substances. Those using opioids as their drug of choice tended to start using some illicit substance at about the age of 12, an age younger than that of CODC clients who did not describe opioids as their primary drug. In our court, people abusing opioids also tend to be women. But these are the clients who are relatively more likely to graduate, which suggests that we are having a particularly beneficial effect with prescription drug abusers. There are various estimates of how much money the Co-Occurring Disorders Court saves to the state because of reduced incarceration. By any measure, we are saving money. Our contracted evaluator estimates that for every $1 spent on the co-occurring court, $3.76 is saved to the criminal justice system. But that calculation does not include the difficult to quantify but profound costs to victims of crimes. It does not include the higher use of expensive services such as emergency departments and inpatient psychiatric placements. And that financial calculation does not factor in the effect on a successful defendant, giving a life back to a person, giving a child her father, a wife her husband, a mother her son. The calculation also doesn't include the fact that all of our participants are required to pay restitution, fines, child support, taxes, and any other expenses they incurred based on their criminal conduct. They must work, attend school, or do community service work. They become good citizens of Maine. We have shown that we can improve public safety, support recovery in substance abuse and mental illness, avoid unnecessary and damaging incarceration, and generate significant cost savings, and we have done that since our beginning in June of 2005. But these are difficult times. Our federal funding, which we have rested on for 6 years, runs out in September of this year, although we may apply for an extension for several months. After implementing some cost-saving measures, we estimate we can continue operation at a cost of about $163,000 a year, and we're currently in the process of obtaining that funding. And finally, next month is the Co-Occurring Disorders Court's 6th birthday. We opened in June of 2005 after a significant planning period that started in 2004. And looking back, thinking about it, I think that planning was a key to our success. We thought very carefully about, among other things, the professionals we needed at the table to succeed. And then we filled those job descriptions with truly superb people. And I believe we have succeeded because of the people involved in this court who remain committed to the task and who remain faithful to our 3 guiding principles. Number 1, we're a 24/7 resource. Number 2, we do not take no for an answer from the system. And number 3, we like our clients. They are not the adversary. They need our help. And I want to mention the team members' names, many of whom are not here, but some are here. Justice Michaela Murphy helps now when I'm down in Portland trying to set up a second co-occurring disorders court. District Attorney Everett Fowle and Assistant District Attorney Deb Bertos are here, and I'm happy they are because I just want to say that there was a reason why I opened this court in Kennebec County, and that was because of the enlightened district attorney who was there. You know, every day we think about what would happen if something goes wrong with one of our clients, and I expect that Everett and I would figure prominently in the newspaper coverage. But the difference is Everett's elected and I'm not. So he deserves great praise for his willingness to think differently, think outside of the box, and work collaboratively with all of the people involved in this court. Elizabeth Simone from May Pretrial. We are case managers, T.J. Wheeler and Aaron Ponton. Hartwell Dowling from the court. Dr. Anne LeBlanc is our consultant. Roxanne DeMarco is our clerk. And from Crisis and Counseling, we rely heavily on Peter Wall, Russ Kimball, Mike Mitchell, and Bob Kingman. We also have extraordinary support and cooperation from Sheriff Liberty and his staff, and a devoted stable of defense attorneys. It's the people who make this court successful, and I can tell you only that I am honored and privileged to work with them every day, and I accept this award on their behalf. Thank you so much.